It's a people, it's a community, it's a life, it's a heart, it's a spirit.
Parents of gay children say, I want my son, my gay son, to have the same opportunity to come to me and say, hey, Dad, I'm getting married, as my non-gay son or my non-gay daughter.
The heck would you want a picture of a tattoo of $1,000 on your penis for? You might just need to satisfy yourself sexually alone at that point.
Do I regret it? Not one bit. Did I think that I would actually take it to the next step and do it again?
And what goes into their life, how they handle it. There are 12 houses, and each one of those houses has a particular function.
Look into yourself, think about it, and just be whoever it is that speaks to you.
Hello and welcome to Talking About. My name is Jon Griffith. I am your co-host along with...
And I'm JC Alvarez, and we're very happy to welcome as our guest today, Dr. Frank Spinelli.
Hey guys, thank you for having me.
No, thank you for coming by and for writing this amazing book.
Well, thank you.
Yeah, The Advocate Guide to Gay Men's Health and Wellness.
It's a mouthful.
It is a mouthful, yes, yes. Now, I mean, it's like, you know, we talk about, you know, I'd like to see a light at the end of the tunnel. How does it look as far as like finding a vaccine or even a cure to HIV?
You know, yeah, I would like to find a cure too. I think everybody would. I think this was a really troublesome year for us on a whole. On the HIV front, Merck pulled their vaccine trial, which was a very long trial that they had been working on, and it didn't pan out. And that was upsetting for many reasons. One, because we wanted a vaccine, and two, all that we might have learned from a vaccine on a cure possibly. I don't know if we're any further on that frontier as well, and on the cure frontier. I do know that this was a banner year for us on the HIV front because we have new drug classes. Right. There are many different classes of HIV that we had before, but now we have even newer ones. So that makes it really interesting when you're looking at treatment, especially in patients who are on older, tough regimens, and switching them off. I had a patient that used to have to take an injectable drug, and to take him off that, the freedom he has now, the freedom to go on trips and stuff where he doesn't have to take a needle. So it's the little things you forget in your day-to-day life, and then you see the little changes that you can make in a patient's life, thank God to technology. So I think we make advances in one way in treatment, not so much maybe on the curative side.
Well, but those are still lights at the end of the tunnel.
It's definitely, it's great. I think one of the things that drew me into, I'm an internist, but one of the things that drew me towards HIV was that it was like a new frontier. I mean, there were no textbooks. We were doing it on our own, and we were figuring it out. And one of the great things and the privileges that I have is that when I go to dinner programs where I meet other doctors and you see how they practice, and you think, wow, it's just like being on the frontier. We're all just trying stuff and seeing what works great. And that's the exciting thing. I'm going to be going to Mexico City August, next month, to attend World AIDS, and that's going to be very exciting because that's a global thing.
Now, those conferences where everyone gets together and they discuss new issues or
well, a lot of them presenting studies that they've done, local studies, and they've created posters or abstracts, and they get published, and you get to attend them like a convention and look at them.
It's a circuit party for doctors.
That's what I think it is. It's a cover-up. Yeah.
But we all wear polo shirts and jackets. They might make a disco
That's
ball.
not true. We'd never accuse you of that. Absolutely not. Now, there's certainly. Go ahead, John. You had a question.
It's gone.
I'm sorry. We already talked about HIV and how important that is, and how relevant it is to the community and so forth. But there's other STDs out there that we also have to take note of, and sometimes our relations with our doctors, it's like we lie.
You don't want to open up.
No, it's like, oh, I have a blister.
Well, I mean, when you think about it, in the grand scheme of things, the most prevalent STD is herpes. Probably 1 million cases each year.
Right.
It's a lot of cases, and there's a lot of them that go underdiagnosed. And this is not just herpes type 1 like the cold sore, this is genital herpes. And then clearly chlamydia, gonorrhea, the increasing rates. And like I said, syphilis went up for the 7th consecutive year among men who have sex with men, particularly them. So STDs and gay men kind of go hand in hand. I mean, and a lot of that has to do with safe sex. So when you think about, we always talk about safe sex in relationship to HIV, but you're also thinking about all the other STDs, gonorrhea, chlamydia, syphilis, herpes, and I say them all. I keep
think
forgetting.
so,
Maybe I
yeah.
think left out one. Or even hepatitis. That's considered a sexually transmitted disease. So we always think about, well, you know, I talked about, remember Good Times, and I remember it was a very controversial episode where JJ got VD, and I wanted to know what VD stood for, and I had to look it up for the book and everything. And, you know, and the clap and all these other crazy names that they came
I love
up
that clap.
with.
The
Yeah,
clap.
the clap.
Oh, you love it?
I mean, I don't look past it, but it's like,
I just love the term.
it's a great name.
But the fact that these are treatable, at
Right.
least gonorrhea and chlamydia are, herpes is treatable but not, you know, curative, and syphilis, which can be a very debilitating disease if left untreated. These are not something we should really laugh at, although it's sort of funny when we talk about it in this text, but these are serious things that you can really get serious infections from. Gonorrhea can become a systemic disease and be very, very damaging to you. So I, as a gay doctor, speaking to patients, whether they're gay or straight, always ask them if they're sexually active. And even if they're in relationship, are you sexually active outside this relationship? You know, opening your mind that there are relationships that exist that are not like, you know, maybe my mom and dad, which probably, you know, they were married since they were 17. There are gay couples who freely admit that they have sex with other people, whether it's alone, together, whether it's this don't ask, don't tell. And that's the role of the doctor, not to judge, but to just find out the facts so that you could better help them. You know, you would imagine that if somebody came in with symptoms of an STD and you said, oh, don't you have a boyfriend? Yes. Well, then he must not have STDs. Well, then you're doing a disservice to everybody involved. So just talking about how sexually transmitted diseases get transmitted and just having that dialogue with patients.
And the book establishes that relationship with you know, between yourself and your doctor, and how you do have to have, you know, that sort of like, you know, just casual relationship, you know.
Right. I mean,
casual to a point.
Well, I mean, it's like that you can, you know, that you can discuss certain things with and just be upfront about anything, because, like, you know, you have to rely on that individual and that information that you're getting.
Yeah, I think one of the best things anybody ever taught me was that, you know, the relationship you have is very important, but you're in on it. You're in on the decision-making process. I can't just do everything. And there's a lot of times where you think you've told something to a patient, you've given them, you must do this, you must cut out your salt, you must cut out the fat diet, and then you never see them anymore. You know, so.
Well, no, you made me cut out all that stuff. Why don't I want to see you anymore?
But that's the idea. The idea is to get the patient involved in their health and want to do better. And I've had a string of patients recently who were diabetic and hypertensive, which is still major health concerns for everybody, not just for gay men, but getting them involved in wanting to be healthier. And I loved my sister Maria, because she was always like on a diet. She used to say, I'm going to put the diet on Monday. Every Monday was diet day. And that's a wrong way to live. You know, it's a lifestyle. So that's where the whole idea of this book, wellness, comes in. Not changing your life in that dramatic moment, but just altering it slowly so that you can live a happier, healthy life, you know, in the long run, not just dramatically in one day.
well, what are some simple first steps that people can take to do that?
Like, as far as health and diet, you know, I grew up Italian-American family. We ate everything that was wrong for you, everything that was fattening and gray, and we were probably all chubby, and it really dawned on me when I first moved out of the house what I could do to eat that would eliminate some of that. And obviously an exercise program is great. I commend that, and you know, you should definitely see your doctor and see if you're able to exercise, because I think aerobic exercise is very good. A lot of gay men do weight training, but even alternating that with weight training and aerobic exercise can really help you lose weight if that's what you want to do, or just stay the same weight. I think eating, my big thing is remove anything white that's refined. White flour, white rice,
Oh, I gotta
sugar,
have my white.
and
I
salt.
gotta have my Wonder Bread.
I know. But you can make some concessions, you know. It's not about restricting yourself fully. It's just about making these alterations. I had very high cholesterol when I was in my 20s. Now I don't. I've made certain changes. I love cheese, but I try to stay away from it a little bit. But if I go to a restaurant, I'll eat it. So it's just making these little agreements with yourself about what you can give and take to yourself. And you can't think of everything as being a punishment, because that's not a way to live. If you think I can never have ice cream again, you're going to be depressed all the time. So you give yourself a little reward once in a while.
Yeah, so that frustrates me, because I like to eat.
Yeah, well,
I do.
give
you can
anything
stand
away.
it.
No, but I do, and it's like a really, and I'm Cuban, and it's kind of like, you know, it's, you know, our food isn't exactly the healthiest in the world, but like when you break it down, I remember my mom used to make substitutes, like, you know, when she'd make a traditional Cuban
Put
meal.
some brown rice in there.
Well, she would.
Well, that's good.
And I
That's
thought,
smart.
oh, hey, you know, it's like, you know, it was a switch, but it was, you know, it helped me as an adult kind of like make that transition.
It's so hard. Even every time I go home to my parents, even like this past weekend, my mother's making pizza, and I'm just
Ooh.
cringing. But you know, I'm going to eat it. And I see that my father had heart disease.
Right.
My mother's got high cholesterol. There's stroke in my family. You know, it's like the trifecta. It's waiting to happen to me at any moment. And you have to make these adjustments now before it's too late, because you don't want these decisions to be made for you. And the other thing is, I grew up in a household that didn't take medicine. My mother didn't believe in medicine. So
Or going to the doctor.
Exactly. We never went. And so I don't know how I'm a doctor. That's why she doesn't want to talk to me. But I understand that. So I'm a little remiss about putting people on medications right away. And getting back to the HIV, that's another big step. It's that you're going to go on this medication for the unforeseeable future. Right. If there's something you could avoid, like cholesterol medication, maybe with diet, then do that. You know, try to fix what you can in yourself before you have to rely heavily on medication. That's my belief.
Now, you brought up a really interesting point, family history. My mom recently passed away. She had cancer, and I recently found out that my grandfather also had cancer. And my brother, who hadn't seen a doctor in almost 20 years, you know, and he's 44, you know, was asking me, he's like, well, should I go see a doctor? And I'm like, well, what do you think? You know, your mom just passed away of cancer, and historically it's in our family. Is it important to look at our family histories as far as like how it affects us?
Absolutely. I feel like your family history is probably the most important predictor of illnesses in your life. I mean, we look at all the Framingham studies that look at heart attacks, how they're directly related to family history, cholesterol, and other things that are just linked genetically. And it's important for you to tell your doctor, especially, you know, one of the questions I ask is, are your parents alive? How old are they? What are their medical problems? And then if they're deceased, what did they die from? And at what age did they die from that? You know, my father, I think, had his first heart attack in his late 40s. Oh. That says a lot for me. And then he had, you know, quadruple bypass surgery and a valve. that opened my eyes a little bit. I need to worry about heart disease in me specifically. Being men is also a link to higher risk. So that brings up a very good point, especially certain cancers that run in family. We know about breast cancer in women, but there are other cancers that are related that are definitely genetic, and you should always bring that up to your doctor. And I think that portion where we call it the social history and the family history really needs to be really investigated, especially when there's a disease that's throughout generations, especially when we say first-degree relatives like your father, his brother, maybe their father. We know colon cancer. The top three you have to consider are really important things you need to rule out when you're looking at your life. And your brother at 40, definitely. I think everybody, I think everybody should have a full physical exam at some point in their life, but if anything, make it 40. Make it your 40th birthday. Make that the year you do everything. You get your eyes checked, you go to the doctor, you get a full physical, you get some screening labs, and then go from there and see how you feel. I mentioned in the book one of the big turning points was turning 40, and although I sort of felt good on the outside, I wondered how good I was on the inside. Like, is it really reflective of everything that's going on? And I'm a doctor, and I'm sitting there looking at myself going,
because if it looks good on the outside, what's going on with the inside?
What I did was you have that three-way mirror, and you're looking at yourself in the back thinking, is that bad?
I don't have one of those.
I recommend you get one. No, you should get one definitely, because you don't want to end up in like a department store looking at yourself in a bathing suit and seeing that ugly pattern. You want to know what you look like at home. But it's important for you to almost examine yourself. Don't be afraid. Don't be shy. Get in front of the mirror and look at yourself. And notice if you have moles on your back or on your legs, get them checked out by a dermatologist. Don't leave anything to just, I don't want to know it. What I don't know won't hurt me. That's a wrong way to live. Take a very active participation in your health care. Really go into your doctor with a list if you have to. And I know every doctor in the world is going to kill me for saying that, but a list of a couple of questions. I'd like to talk about this. I have this that runs in my family. Should I be concerned? What do I have to do at this age to be healthier? Those are great questions. I would appreciate those questions. most patients come in and they say, I want every blood test. I want to know what cancer I
Oh,
want.
yeah,
If there's any
because you
cancer test-
panic.
Yeah,
It's
of
like, you know,
course.
you usually don't go to a doctor unless something hurts or it burns. That's when you go see a doctor.
You're saying a lot about yourself.
No, I don't have those kinds of problems. But I'm just saying, you know, I've read stories.
No, I understand. No, of course. I mean, everybody, a lot of people wait for the last minute to go to a doctor. They try to avoid it as much as possible. But it would be better off for you to just do that. Every birthday is the day I go see my doctor. Is the, you know, sort of around the time. And I tell a lot of patients, your birthday is your anniversary. That's when you come in and we do the full physical and the whole shebang, and then you can feel free to avoid me for another year.
Now, let's talk about because, you know, I'm gonna be greedy here a second. Cancer. I mean, it's like, you know, I'm 36, which is, you know, relatively young. But should I be worrying with my family history about?
Well, I mean, not that I know too much, but obviously the younger you are, the less you have to worry about cancer. I mean, I had a patient today who's 23. You know, he's worried about, like, he's having heart attacks. You know, the tendency is that the younger you are, the less you have to worry about it. There are certain cancers that are linked to age. If you were in your 30s, I might tell you that men should be very concerned about testicular cancer. And I teach men how to perform a testicular exam on themselves. Obviously, once you get past 40, 50...
We can demonstrate that on another show.
40 and 50, you worry about prostate cancer, colon cancer screening. So there are recommendations by the Cancer Society that you look at according to age and what tests you might need. Somewhere in the 20s and 30s, I might not be so intrigued about getting a cancer screening, except, of course, maybe testicular cancer. That's a younger man's problem as well.
So 40 is sort of like the call.
Yeah, that's my that's my call.
It's a good number.
To start worrying about things.
Do you find that a lot of patients aren't really in touch with their body, and do people really know what's going on inside them?
I think it's interesting. We went through a lot of phases. Certainly the aerobic phase where everybody wanted to have great bodies during the 80s, and really working out made a lot of people really get off the couch and want to go back into the gym. Gyms have just exploded. I mean, there's like a gym on every street corner in New York.
Well,
and I think
if you're down in Chelsea, yeah.
Well, there's some uptown too. But I think it's great that people want to exercise, eat right. We talk about trans fats. I mean, even fast food restaurants now are trying to offer healthy meals, which is great.
I mean, in New York, the calorie count is on the menu boards now.
And I think it's really important that you know that. So I see people taking that active participation and wanting to eat better, wanting to exercise and look better. And I think that does go part and parcel with the fact that we're living longer. I mean, certainly we know that the longevity of men and women has increased substantially as opposed to like maybe 30 or 50 years ago. But I could see where you could see like a certain percentage of people don't want to know anything, and they just live their day to day, and they don't even want to get their eyes checked, and they need glasses, and that's upsetting, because I think when I see certainly men my own age, I think go to the doctor already. Just go, and don't be so afraid. It's not such a horrifying experience. I think we have to remove that stigma that going to the doctor is like going to the dentist. You know, it's going to hurt. It's really not as painful as as most people paint, but it's very, very vital.
And as you prove in the book, if you have the information, you know, you're one step ahead of the game, because, you know, once you have information, it's
like easier. Anything. I mean, once you have some sort of information, it dispels the myth, you know, so then you don't like let it fester in your head and create this big, oh my God, I can't go to the doctor, I know it's cancer, I know it's cancer. And you hear patients say
Where's the Windex? Where's the Windex?
Exactly. My mother used Vicks on everything.
You know, my mom used to use Vicks on everything too.
I don't know what was it. She loved that.
It just smelled really great. You know, it was a cure-all. Yeah.
That's tough. Tough on the senses.
Yes, it was. Yes.
But then, I mean, I know with myself, I had the best of intentions with most things, and I follow through. I mean, I eat very well. I guess probably about 80–85% of the time. Too much sugar, I know that. But then there's the other side. The physical activity. I belong to a gym. Right. I pay the dues every month.
But
that should be enough, right?
It's an exercise on your wallet. But well, then make that deal for yourself where I might go once a week. One of the things we do, it's unfortunate that we do this all or nothing. Well, if I don't go every week, or if I don't go every day, then I shouldn't go at all, and it becomes this burden to us that we don't want to get out of bed. So go once a week. or walk, or go for a bike ride, or do something that's out of your activity. The easiest thing you can do if you work in an office, take the stairs. Just change yourself from your natural activity to give yourself some more physical activity, which will really help you in the long run. I mean, I have to actually try to go to the gym in the morning, because if I don't go in the morning, I'm never going to go. And sometimes there's nothing more I want to do than just lay in bed and rest. But if you get at it, if you make yourself that deal with, okay, I'll go twice this week.
Right.
Just make yourself that little change. It's nothing that has to be so dramatic. We think it's either all or none. You know, maybe we've been brainwashed by TV that we have to look a certain way, but if you just make minor adjustments, you can really change your life.
You raised a good point before. You said, you know, it's especially gay men. It's like all we do is want to go to the gym and work out, but there's other things. Well, you know,
they're obsessed.
It's like you work out and you lift weights, but I mean, it's like yoga's a fantastic exercise that everyone's sort of just like.
There are many different ways of exercising. You don't even have to always go to a gym. I mean,
walk your dog.
Please.
You know, please.
But no, you're right. I mean, you don't necessarily have to go to a gym. I know a lot of friends who take yoga. I know a lot of friends who go bicycle riding or jogging, even own a stationary bike and use it, you know, not just hang their clothes on it. But that commitment to yourself that you're just going to change something about your lifestyle in the next few months, and give yourself little goals. That's the best thing you can do, instead of saying, well, if I got to lose 20 pounds. Well, don't think of it that way. Just look at it as, I'm going to do this in the next month. I'm going to give myself 30 days and see how well I do. And if it doesn't work, then you start all over again. It doesn't have to be all or nothing.
Right. Well, what I really enjoyed most about the book is that it's, you know, it's just, it talks to me like very naturally, like very easy.
Very frank.
It talks to me very frank. You know, I didn't want to say use the words. No, you know, you can't help. But it's the fact that it's all really simple. It seems like living a really healthy lifestyle, and you know, and it seems really easy.
I don't want to give away that impression that it's all just so simple that anybody can do it. It is hard work, and if anything, I hope it came across that I'm just like a lot of the people that read this book. I had to go through a lot of these issues. I had to learn this stuff for myself. I was an overweight kid. You know, we bought Billy the Kid husky jeans. And I chose to change my lifestyle.
Hi. Okay, we do have another call. Caller, whenever you're ready, please say hello.
Hi, Dr. Frank.
Hi.
You have a question? Hi.
Yes.
Yeah, I was wondering, I heard some information about the morning after medicine for HIV.
So post-exposure prophylaxis is when you take HIV medication for a period of 28 days after the initial exposure, but usually it has to be less than 36 hours after you've been exposed, hopefully less than that. And if you take it for the 28 days, the idea is that you won't contract HIV.
And like you said before, it's not a solution.
Well, it's not to replace the idea of having safe sex.
Right.
Exactly.
Okay. Well, I have your book, and it's just great. It's actually I bought copies for a lot of my friends, and it's just a great inspiration and great guidance for me and my friends.
Well, thanks, Mom.
I just want to say thanks very much.
All right, well, thank you for calling.
Okay.
Yeah, it must be a really great feeling for you as a doctor, like when you help a patient like that, like find something that they didn't know was there before and help cure them of something.
I mean, I think that's
or offer advice.
That's the beauty of medicine, and a lot of what my mentors have said to me is, being a doctor can be very tough. I mean, you deal with a lot of, a lot of people go to the doctor for
when you get
things
sick.
Sick, so you hear a lot of the complaints. And I think when you finally feel like you've helped somebody that day, it's such an accomplishment. And that's the beauty, especially with something that's like a disease state like HIV or cancer, and you actually go through it with them, and then you come out of it with a really good outcome. Yeah, there's nothing that could be better than that. That's really the reward in medicine. But you don't get those days every day, so.
Well, it's a process. Now, the book, again, is The Advocate Guide to Gay Men's Health and Wellness, and, we certainly hope that you're thinking of a follow-up, right?
Oh, I'd love to. Why don't you contact Allison Brooks?
Well, no, because...
Put that bee in their bonnet.
Well, because, it really is a great start.
Well, I think, if the book stays in print, definitely I'd like to do a follow-up. Certainly there are things that are going to change and evolve, and of course, the HIV updates and a lot of the other information we offer, certainly MRSA, the methicillin-resistant updates, how it's changed. And
yeah, talk about that really quickly.
Well, the interesting thing is that staph is an infection we all know about.
Exactly, yeah. And anyone can get it. You don't have to. You don't have to have
it's
HIV.
It's not a sexual
yeah,
contact. It's actually just through contact,
Sure.
even using someone's towel or sheets or gym equipment. And it first showed up in nursing homes and in hospitals. And it was in the elderly, and they were getting what we used to treat.
It's not bed sores. It's not like
no, it's not,
okay.
Well, it can be a bed sore, but it's something that
be.
infects your skin. So initially, it was treated with penicillin, and then it became resistant. And over the years, it's become resistant to methicillin. So now we have methicillin-resistant Staph aureus, and in the past few years, we've seen a surge in the population in gay men, probably because of the use of gyms and jacuzzis and just the contact that they have. And over the years, we've had to really be aggressive on how we treat this because it can be really devastating. And I've seen it really affect patients where they've needed operations and hospitalizations. And so the message, we had to put the message out there that if you were a gay man and you were getting a rash or you were getting something that you thought was a bug bite, you should go to your doctor and you should ask him, what about MRSA? How do I diagnose it? And he should diagnose it with a culture, and he should be putting you on the right antibiotics. And we talk a lot about this with doctors because you have to be placed on the right antibiotics, because if you go on something that has a penicillin base, it's not going to work. And then recently there was a new multi-drug resistant strain of MRSA that cropped up in San Francisco and I think also in Boston. And a lot of the media picked up on this story and started calling it the new HIV and really blaming gay men. And I think it appeared in a London and Australian newspaper. And I was really proud of the Advocate themselves for coming out with an article saying, look, this isn't a gay disease. This is something that is affecting gay men. And we need to address this, because I think when we live in that fear where we're going to scare you into something, what does that do? That makes you want to stay home and not take care of that bug bite. So the idea was saying, no, we need to really teach our patients and our community about this. Go and see your doctor. Go get tested. Go get treated. And it was definitely so important that I had to make a whole section for it in the book. And I think I think in the slideshow and in the book we show some pictures. And it can look so unassuming as a small little pimple on your chin to something that looks, you know, really horrifying.
Well,
And if your doctor is frank, why would you not want to go see your doctor?
Exactly.
I don't know.
Just in the last few seconds of the show, just
you mean we're done?
Just about.
I don't want to go.
Is there one or two simple things that people can do to live a healthier life that you can think of?
I mean, really simply like what we said, I think definitely find a doctor you feel very comfortable with. Go to your doctor at least once a year, ask for a full physical exam, and definitely give him an honest history. May not be the first day, but definitely come back to him and do the follow-up and come up with more history to give him. And then definitely if you're gay and you have a whole sexual lifestyle, be aware of sexually transmitted diseases, be aware of HIV and the transmission rates, and be very safe and use condoms.
And all of this is in the book. In your book. And I want to thank you for joining us. There's more information about Dr. Frank at our website, just redone, www.talkingabout.info. I'm Jon Griffith.
I'm JC Alvarez.
Thank you and have a great night.
Yeah.